welcome back to my channel. I hope you guys are doing lovely. So today's video, we are talking about 4 types of Psych RN jobs that I've had and the subspecialties in Psych Nursing. So if this is something that interests you, stay tuned. So in one of my videos, I had someone comment saying, could I go over what a shift looks like at the different RN jobs that I've had? Just pretty much asking, can I talk about the different types of specialties I've worked in psych? So that's what we're gonna do today. So if you guys don't know who I am, my name is Artasia Olivia, and I am a Psych RN. I'm currently in PMH and P school, and I'm almost finished. I'll finish in February. It's currently October, so I'm almost done. Got a couple more months to go. So I currently work as a Psych RN, and these are 4 actual jobs that I've had that we're gonna go over. And let's get into the first one. So the first one is child adolescent long-term care. And so this is pretty much long-term treatment for children that are suffering from psychiatric conditions. So the kids were about 9 to 21 years old, and they were really pretty much like troubled kids. Some of them had psychiatric conditions, but I feel like most of the time it was like some type of behavioral issue. So a lot of the long-term psych facilities that treat children, a lot of the behavioral health can come into play with the children. So I know you guys heard of like psychiatric facilities and behavioral health facilities. So like a lot of the children, it's like very, very like heavy behavioral health. And there's like a difference between behavioral health and like psych. But it's all the same thing, obviously. But behavioral health, like the children, like a lot of them came from like DJJ, which is like the juvenile justice system, Department of Juvenile Justice, and like, which pretty much means like juvenile detention, juvenile jail. A lot of them were DFACS kids, so a lot of them were like in the foster systems. Most of them did not have like family, and they didn't really have that structured environment. So it led to a lot of behavioral misconduct, obviously. You know, a lot of them were not doing good in school, getting in fights, breaking the law, and different things like that. So after they got their psych evals, a lot of the treatment was more so like psychotherapy that they had with therapists, and there were therapists there. They had like school there so they can like stay on track and not get too far off. The facility I worked at, a lot of the facilities don't really have school, but the facility I was at had school, they had the therapy, and then they had the psychiatric medications that they were getting, just to really help their diagnoses. And a lot of their diagnoses were like suicidal ideation and just different things relating to children's psych and behavioral health. So about the shifts, they were like 5 8-hour shifts, and the facility was open 24/7. It was about like 4 sides, and each side had like 15 to 20 different patients. And I worked night shifts, so most of the time we were like, it would be 2 nurses there, and 2 nurses get 2 sides. Sometimes if they're really short, we would have all the patients, but again, it wasn't as bad because at night, because a lot of the patients were sleeping. So it wasn't bad to have that many patients per nurse. And then in my other video, I talked about like the pay at all of the psych jobs I've worked at. So I'm not going to talk about the pay in this video, but if you guys are interested in like the pay rate, check my other video out later. That was the child adolescent. Those kids, when I tell you, they were off the chain. Like when I did my training on days, they got active. They were really, really busy, and it's crazy because I used to be a pediatric nurse in a primary care setting, and being a pediatric psych nurse was like completely different. But honestly, out of all of the jobs, I feel like the patients were the most misbehaved at that facility, due to the fact that they were children. I feel like I liked working with the adults better because the children, it was a lot. And anything you did, or any like intervention or anything that we had to change, we always had to like consult the parents and get consent, or if they didn't have parents, consult their social worker, caseworker. So it could be like a lot on top of like the regular like work and responsibilities that treating an adult patient may have. So yeah, that was my first psych job. My second psych job was adult crisis stabilization, and that pretty much was adults 18 to 70 something, and they serviced psychiatric conditions and detox conditions. I really liked that job. It wasn't too bad. It was 2 sides, and each side had about 15 patients max. So that job, you got like a lot of 1013s. You've seen a lot of withdrawal, substance abuse, but it was mainly like suicide ideation, psychotic patients. So like these are like the patients that you'll see going down the street like naked or something. Like the police will pick them up. They will go through like a involuntary like detainment type of thing with the court system, and here in Georgia it's called 1013s. I think back in Florida it was called like Baker Act. So pretty much the police and justice system have to get involved, and they have to mandatory be held in like a psych facility for about like 72 hours, and like against their will. So it was a lot of like psychotic patients, a lot of acute psych. So some of these patients you will see like at an ER that's there for psych, but the job there was pretty much to stabilize the patient and get the patient calm before they can go back out in the real world. Usually if they don't go back like to a family or like to like an actual home, they will go like to a long-term care facility, and I'll get into that later. But yeah, this job was not bad at all. It sounds scarier than what it really was. So pretty much what a shift looked like is like pretty much what all the shifts at all of the jobs, they pretty much all entail like assessing your patient once you get there, and then you'll do some sort of medication pass, and then after you do your medication pass, and this is for night shift by the way, after you do your medication pass, you'll sign any paperwork that needs to be signed, and then throughout the night, if they wake up, you'll redirect them, or if they need like any medical attention or anything, you would refer them to either the psych NP, or if it's like very serious, you'll call 911 and transfer them out to like a medical facility, because a lot of these psych facilities don't have much medical interventions that they can do. So you'll usually transfer these patients out, and then they'll sleep throughout the night, and then you'll pass any morning meds if needed. Not everyone have morning meds most of the time on night shift. And then once you pass your morning meds, if anyone needs any blood sugars before breakfast, or any insulin, you know, you'll usually do that. But that's pretty much what a lot of the nights look like at all of the facilities that I'm going over. And yeah, very simple. The only thing that's like spontaneous is like if anyone have any like medical issues, or if anyone have any psychiatric issues. Oh, and I forgot to mention, so yeah, the first and second, well, really all of these facilities, you have your nurses, you have your techs, and you may or may not have security, and you may or may not have a Psych NP on hand, like on standby. So the first job that I mentioned, I forgot to mention that they did not have security. This job, they had security, so that was very, very helpful for when the patients, you know, started acting psychotic. But it made more sense for, you know, the acute facility to have security, which they did. And yeah, so let's go on to the third one. The third job that I worked at was a detox/rehab center. So like half of the facility was detox patients and service detox patients that were like withdrawing from drugs or alcohol. And then the other half of the facility was patients that finished detoxing, they just wanted some extra help and wanted to go through rehab program to further, like, you know, get on the right path. So that job was very interesting. Like I mentioned before, the second job had service detox patients, but this job, it was all straight detox. And this job did not have security on hand, and they did not have any Psych NPs on hand. The first job didn't either have any Psych NPs. The second job that I had was really the only job that had Psych NPs there. Well, I take that back. The last job I'm gonna go over did have Psych NPs there as well. But yeah, this job, it was straight detox. So we did a lot of the Psych NP work as Psych RN. So I felt like I got a lot of exposure to what Psych NPs do. So we did like the admissions, we pretty much prescribe like the medications, but they all follow a certain protocol, so we already know which medications we're going to give the patients. And yeah, we did the admission, we signed the paperwork. We did a lot at that job in regards to like Psych NP type of work. And the work that we did, the Psych NPs would come the next day and pretty much check over what we did. So like, let's say the patient came in from withdrawing from alcohol. So like there'll be a whole alcohol protocol of what we do that was already pre-approved by the doctor and by the Psych NP, and we just follow that. So when I say we were doing Psych NP work, it wasn't like that, but it was just like, it felt like that type of work, because we would put them on like the Librium taper. We'll see how many days they need to be tapered. If they were on like withdrawing from another substance, we will have to like figure out which medication we'll put them on, how many days they need to be on it, when do we start that medication, can they start it immediately or can they start it later. So yeah, I was really getting a lot of like experience working at that job. It was really cool, and it was actually my favorite psych job out of all of the four that I'm gonna list. So yeah, that's that one. The fourth one was adult long-term care, and that's the job that I'm currently at now. And this job is pretty much the same thing as the first job I mentioned, but it's only adults. So like, these patients have like chronic conditions, chronic psychiatric conditions, and it's not as much behavioral health as dealing with the children. It's definitely more psychiatric mental health conditions. And I actually work on the forensic unit as well. The place that I work at have forensic units, and they have like just only mental health psychiatric units. But this one in particular are inmates that pretty much plead insanity, or they can't withstand a trial. The judge feel like they're not competent enough. So they'll send them to like the forensic unit, and they will do their time at my unit, at my job. So yeah, this is pretty much the same thing as a child adolescent long-term care. Yeah, and I actually have a video of what working a shift at that job is like. So if you guys want to check that out. And this job, yeah, it just pretty much confirmed that I'd rather work with adults instead of children. With this being my 4th psych job, it pretty much confirmed, yeah, that I really like psych, and that I've seen like different aspects of psych. And it really much confirmed that I really like all the aspects of psych. I like, even though child and adolescent wasn't my favorite, it was still better than any other specialty that I did. So I pretty much like the child and adolescent units. I pretty much like the adult crisis stabilization units. I pretty much like the detox and rehab. That was my favorite, surprisingly. And I like the adult long-term care that I'm working at now. So it's like really any psych place you could name or put me in, I feel like I would really like. So yeah, that's what this job kind of did. This job, there is about 2 sides, and there's about like 22 patients on both sides, and usually we have like 4 to 5 nurses working in total. So it'll be like 2 or 3 on both sides. So definitely the patient ratio definitely wasn't too bad. And I think this one has the best patient ratio because we have the most help with you know, this facility. But that could also be because it's forensic inmates. So as far as security, oh yeah, the last job didn't have security, and this job has security, but they don't intervene for any like psychiatric codes or medical codes, or they don't really do anything. They pretty much just like guard the entrances and make sure and like regulate who comes in and out of the facility. I know this like video was kind of like but I know I just really wanted to answer the person's question that asked could I go over like what each of these jobs look like. I hope that covers it. You know, that's just all what I could think of. If you guys have any more questions about any of these type of psych jobs, definitely comment down below and I'll answer them. I answer everybody's questions and comment back to everyone. So if you guys like want to know any more detail, like like, you know, I have a question about the child and adolescent, or I have a question about the detox rehab, whatever you have a question about, just comment down below and I'll answer. I don't know if I need to make a part 2 of this video. I feel like I was pretty thorough, but let me know if you guys would like a part 2 of this video, and I can answer even more questions about each of these facilities. But yeah, toodaloo, bye, catch you in the next video.